I'm going to go over the Quizlet for exam 2. You can see that there's 6 Quizlets here, and I just want to point out I won't review like the hypocalcemia, but you're going to need to know this for exam 3 also. So I would suggest you go in and kind of test yourself. And this is what I tell students. For hypocalcemia, calcium is a sedative to the body, okay? So for hypercalcemia, look for those signs of everything slowing down. And then for hypocalcemia, if the calcium is low and calcium acts as a sedative, if somebody has hypocalcemia, they're going to have tetany. They're going to be irritable. They're going to be jumpy. So make sure you know those signs and symptoms. Make sure you know the signs and symptoms of like Chvostek's and Trousseau's as well. Okay, so what I'm going to do is I am going to start and go over diabetes first. As you know, diabetes is a chronic disease, and we're going to go over the difference. You're going to have to know the difference between type 1 and type 2. So type 1 is what we used to call juvenile diabetes. It occurs in younger children and young adults. It's very unusual for somebody to develop diabetes as an adult. And if they do, that means they probably have a couple of diseases that we'll talk about for exam 3. Okay, so diabetes 1 is caused by an autoimmune process that destroys the beta cells in the pancreas. Remember, the beta cells are the cells that secrete insulin. And the pancreas is a unique organ in that it has both an exocrine function, so that means it secretes enzymes that help us digest food, and also an endocrine function with the various hormones it produces. Okay, so insulin metabolizes nutrients for us, and then we need to remind our patients that that have diabetes that they need to maintain tight glycemic control, because there are a lot of vascular problems, renal problems, retinal, and neurological complications related to hyperglycemia. So we need to make sure we're doing really good education about that. And then with type 2 diabetes, this is caused by insulin resistance, okay, due to genetic and lifestyle choices. Now, you're going to have to know who gets diabetes 2 or the characteristics. So typically they're people over 30 and they're obese, so they have a BMI greater than 30. They have a history of gestational diabetes, a family history of diabetes, and they're sedentary. So in other words, they're not engaging in daily exercise. And then people with metabolic syndrome, you're going to have to know these characteristics. Usually people with metabolic syndrome have like 3 or more of these conditions. So a fasting blood glucose of sugar of 100 or greater, triglycerides greater than 150, blood pressure, high blood pressure, and central obesity. Obesity does play a role in diabetes too. So the cornerstone of diabetes treatment is exercise and lifestyle changes, such as diet. That's a huge one, okay? So diabetes 1 is prone to ketosis. So they're prone to diabetic ketoacidosis if they get sick or stressed, and we'll go into a little more detail with that, but you have to understand the type of diabetes and what it's going to lead to if they're stressed. Okay, so type 1 is DKA. Type 2 is HHS. A hyperglycemic hyperosmolar state occurs in type 2 diabetics if they get overstressed. Okay. Type 1 is always going to require exogenous insulin, always will need insulin. They cannot get away without having insulin, and it's not preventable. Nobody chooses to have type 1 diabetes. And I don't mean to say that type 2 is a choice, because there's a lot of factors such as the genetic and lifestyle choices that go into it. Now, when somebody is on insulin, you have to teach them to rotate the injection sites, because they're going to get lipodystrophy if they don't, and you don't want that to happen. And then Tight glycemic control, I talked about. You're going to have to know about the 3 Ps of diabetes. So polyuria, they have increased urination because when you have sugar in your bloodstream, sugar makes it hyperosmolar. Okay, so that makes you diurese. Okay, so that's why they get that. And then polyphagia, especially people with diabetes 1, because their body is saying I'm hungry because they're not able to metabolize the carbohydrates they take in unless they have proper treatment. Polydipsia, they have increased thirst because they're diuresing essentially, right? They're urinating a lot. So they have to make sure they have adequate fluids. And then glycosuria. So that's presence of glucose in the urine. And usually if people's glucose is greater than 220, it will spill over into the urine. So if somebody has glucosuria and they're a diabetic, they're probably not managing their diabetes well. Okay. Um, and Patients with diabetes are prone to infection, delayed healing, vascular, and also eye diseases like glaucoma and retinopathy. And then, so they do this test, the A1C test, and it's used to measure the average blood glucose over the course of 3 to 4 months, because a red blood cell lives 120 days. So that would be 4 months, but it's 3 to 4 months. And if it's in a good place, then we know they're maintaining tight glycemic control. You're going to have to know the signs and symptoms of hypoglycemia. People can get hypoglycemia if they're like not taking care of themselves, not eating properly. Anytime you give insulin, you want to reassess after for those signs of hypoglycemia. And you can remember the mnemonic be tired. So B stands for blurry vision. T stands for tachycardia and palpitations, and tiredness, which is also considered weakness. So when somebody has low blood sugar, our bodies are amazing. It's going to stimulate the release of catecholamines. So the sympathetic nervous system gets activated. And that's why they have all those symptoms of fight and flight. Okay, because the body is trying to make more glucose. So they get tachycardic, they get diaphoretic, they get hungry. Okay, so the I stands for irritability and seizures. R stands for restlessness and shakiness, and E stands for excessive hunger, and D stands for diaphoresis. So the saying is cold and clammy, give me candy, okay, because they need to get sugar into them. Yes, you should definitely check for hypoglycemia after administering insulin. And what you're going to administer if somebody has low blood sugar, the treatment for that is 15 to 20 grams of glucose. Okay, and you can get it in numerous ways. So if somebody is awake, they can have like juice or soda. They can have non-fat milk or 1% milk, 6 to 10 hard candies. They can have a tablespoon of honey. Okay, so the important thing is make sure you know what are adequate sources of glucose, but also that after you give the glucose, it's not a one and done thing. You need to recheck the blood sugar in 15 minutes. And then after you do that, you're going to give like something to eat that has protein in it. So like crackers and cheese or a meat sandwich. So let's reiterate. Somebody's hypoglycemic, you're gonna give 15 to 20 grams of glucose. Then in one of these sources, okay? Then after that, you're gonna recheck the glucose, but you're still gonna give them something with protein. So giving them something with protein helps the sugar last longer, I should say, I guess that's the way to put it. But you're going to do that after you give the initial glucose source. Okay. So if somebody is hypoglycemic but they can't swallow, turn them on their side and give them glucagon. Okay. So you want to know that. The cornerstone of diabetes management is going to be lifestyle changes, diet changes, and exercise. So you have to counsel them on that. And the reason you want to counsel them on that, it's to prevent the long-term sequela of the vascular problems, the renal problems, the problems with the eyes. to try to keep that at bay. So the cornerstone of treatment is diet and exercise. Um, and then about exercise, you want to make sure that anybody that's a diabetic is always wearing proper footwear. And the reason is they're probably going to have some degree of neuropathy in their lower extremities. And so that means like they can't really feel, right? So that if they have an injury on their feet, they might not even know it. Okay, so knowing what they're supposed to do for diabetic foot care is extremely important because you have to teach them to inspect their feet daily. They need to use clean their feet daily with soap and water. Make sure they're drying well, especially in between their toes, because moisture attracts yeast and bacteria. So you don't want them to get an infection for that. They're going to need to change their socks every day and cut their toenails straight across. Keep the feet dry at all times. If they go on vacation, they need an extra pair of shoes because if their shoes get wet, they'll have a dry pair to wear, and they have to wear shoes. All right, keep the feet dry, wear proper fitting shoes, and trim the toenails straight across. And they can put lotion on their feet. They should daily, but don't put it in between their toes. That's really important. Um, Diabetic nephropathy is caused by hypoglycemia and the vascular problems and the eye problems too. That's why we want them to maintain tight glycemic control. Okay, so the cortisol test, okay, is done to diagnose Cushing's and Addison, so don't get it confused with other tests that we do for diabetes like the A1C. And it's done over 24 hours, so they're going to be woken up in the middle of the night. The fluid deprivation test is done to diagnose DI in patients with polyuria. Now, diabetes insipidus has got nothing to do with diabetes mellitus, so make sure you understand that people with DI have no alterations in their blood sugar. The A1C test I talked about, and that's important to know. The target is 7% for somebody with diabetes. Normal is 4 to 6. Now, you're going to have to know signs of high blood sugar to anticipate who is going to get DKA or HHS. Okay, so with high blood sugar, you're going to have the 3 Ps, right? The increased thirst and urination leading to dehydration, red, hot, dry skin. They're going to have Kussmaul's breathing. They'll have acetone breath, loss of appetite, nausea, vomiting. And this is important because they don't want to eat. So you're going to have to tell them to have sips of water, to kind of prevent DKA from happening. All right, they're going to be extremely fatigued. So look for an altered mental state, shock, acetone odor on breath. They'll be hungry and thirsty, and they're going to be peeing a lot. So this is signs of diabetic ketoacidosis. Anybody that is a type 1 diabetic that is sick or stressed, they need to keep taking their normal insulin dose because the body is stressing. It's going to produce more glucose, which is kind of hard to explain to people. But they need to also know to check their urine for ketones because when the body can't metabolize carbohydrates or glucose, it's going to break down fat. And ketones are from the production of the breakdown of fat because the body tries to use ketones to nourish itself. Okay, so that's important. The signs of HHS, this happens to type 2 diabetics, and their blood glucose is going to be off the charts. It's going to be like 600. Now, they do have high glucose with DKA, but it's not as high as HHS. They're going to be confused and they'll have extreme dehydration. They do not have Kussmaul's or acetone breath because they don't go into metabolic acidosis. So they're not breathing fast. And then if they're sick and diabetic, they need to take insulin even when they're sick or stressed. okay, and check the ketones if the glucose is high. They need to take sips of water to prevent dehydration. And so the two main problems with DKA is hyperglycemia and dehydration. All right. So so I know you already have pharmacology, but just some key points about metformin. Metformin is needs to be held before contrast dye test to prevent kidney failure. And we're going to go into more detail in exam 3, but you need to know that, and I think you already do. So make sure you know the different kinds of insulin. I have it in my lecture. I have it on the PDFs, some, you know, memory tricks. So like rapid insulin doesn't lag. So make sure you know the types of insulin that is. And you are also going to have to know like long acting, intermediate, and short acting. Remember that regular insulin is the only insulin that can be given IV, okay? And it can be mixed with intermediate insulin with NPH, but you're going to have to know the sequence. So make sure you review the sequence. I have in your tutoring, I put a video of Picmonic about how to mix the insulins. Um, so please review that. That's also probably going to be on your proctor, I believe. So that's really important. So that's diabetes in a nutshell.